take ownership. Take your data into your hands. Take your health into your hands, and own it. Because genuinely, by doing that, you will enable you'll put yourself on the path to living healthier for longer. And who wouldn't want that?
You're listening to the Care Podcast, brought to you by Unique Senior Care. We're here to share honest, practical conversations that help make sense of care, whether you're just starting to explore options or you're already facing some tough decisions. When it comes to staying well as we age, timing can make all the difference. Catching things early, having the right information and taking small steps can help people stay independent for longer. In this episode, we're joined by Dominique Kent, CEO of Bluecrest Wellness and a long-standing leader in the care sector. Dominique brings a wealth of experience on why early health checks matter and how they can help people feel more in control of their future. Dominique, thank you so much for joining us. So tell us a little bit about your role at Bluecrest and also about your background.
So let's start with my background, probably. That's the easiest place to start. So started my career many moons ago in retail. So I did about 15 years working for Sainsbury's, which I thoroughly enjoyed. And that's where I became an operator. So I always describe myself as a jack of all, master of none, which my team tell me off for. But anyway, and in 2005, I'd had a daughter called Ariana, and Sainsbury's went through quite a big restructure. So I took the opportunity to take some time out, and I wanted to work closer to home. And I ended up applying for a job in the newspaper that just called itself general manager. That job turned out to be running a care home, and that's where I cut my teeth in care, as I call it. So I started my career in the care sector in 2005 and had 5 really good years, feeling super privileged to care for older people in that care home setting. Thoroughly loved it, fell in love with the idea of being able to make a difference to people's lives. So, and if there's something that drives me, it's definitely that. And in 2010, I started my career at the Good Care Group, where we created one of the first ever living care services to people, caring for people in their own homes. So that's kind of been my background. And then in 2019-20, as everybody else knows, we hit COVID. So I led that business through those very turbulent couple of years, very proudly. And in 2023, I decided it was time for me to do something a little bit different. And that's what brought me to Bluecrest Wellness. So I guess the thing that runs through everything I do is making a difference. And at Bluecrest, I feel like I found another place that I can make a difference, but in a slightly different way. So not direct caring for people, which I have still got a love for and very much enjoy being a part of in some of the other roles that I hold. But at Bluecrest in particular, this is all about what we can do to make a difference to people's lives for the long term. So engaging earlier in order that we can help people live healthier for longer.
Wonderful. And we're very privileged at Unique Care that you are an advisor, a strategic advisor to us. So you've been able to bring that expertise from all your years in care to support other companies now and to keep your hand in, I guess, in the care industry as well.
Yeah, and I think that's really important, actually. So people often say to me, gosh, you're chief exec of this organisation. That's a full-time job in itself, which it is. But I also do some advisor and non-executive work with some other organisations. But the common thread through all of those is, again, making a difference to people's lives. So whether it's with you guys advising on and helping you in terms of the way that you approach delivering services, or working with a CQC, or whether it's kind of operating models, those kind of things. That kind of thing really, really interests me, and I love to be able to contribute to that and guide and advise and help where I know, before I might have tripped up. But I also do some work in the mental health space, so supporting a business called Remind, and that's supporting people living with PTSD, and another organisation called Thalamos, where I support them with their work on supporting people that are living with really difficult, complex mental health needs that lead them to needing to be sectioned and supported through that traumatic period. So, yeah, the common theme is if I can in some small way contribute to helping somebody's life a little bit better, then I feel like I've done something I can be super proud of.
Yeah, rightly so. We're wondering how you fit it all in a day at the moment. So I'd love to know, with Bluecrest, what kind of stories have you seen about how having health screening earlier on can make a difference to people's lives?
So the beauty of what we do is it's quite simple in many ways. So the way I describe what we do is we gather data. So our customers will go to have their health assessment. They'll attend clinic, or they might do it through a home test kit. So depending on which one they prefer. But they'll attend a clinic, and our really very wonderful health assessment specialists that work in those clinics will help that customer go through a number of different things. So that might be biometric tests that looks at your metabolic age, your visceral fat, your inner health, through to maybe an ECG if that's part of your health assessment package, through to bloods, taking your bloods. So that health assessor will be gathering that data. That data will go off to our partners. So those partners will be people like our lab, so Eurofin's our lab, or Express Diagnostics, who are our ECG partner. They will do the diagnostic piece on that data we've gathered, and that then comes back to us. What we at that point do is pull all of that data into a really comprehensive overview of your health that's simply presented back to you. And that will be presented back in the format of what we call a RAG. So if you've got something you need to do something about, it will be red. So that marker will be red. If there's something that might need some attention, it will be amber. And if you get a green, that's really good. Happy days. You don't need to worry about that. But what it does is give you a really good overview of your body and what's going on inside your body in order that you can take action and do something about it if there is a need for you to do so. And in answer to your question, what we do is help people gain that knowledge, that insight. And in some cases, that insight could give them knowledge of a serious thing they didn't know that was happening for them. So if I just give you a really kind of live, current, recent example of a customer that came into one of our clinics. Customer came in, she came in for a full health assessment. As part of that full health assessment, we do our ECG. That ECG trace is sent through to our partner live, so that feed goes on a constant as health assessments take place in clinic. Within half an hour, we had a concern about what that result told us. We called the customer immediately because it was what we define as a critical. And we diverted that lady straight into a hospital setting to get her heart checked. We saved her life that day. Wow. So it can be that extreme to there is something serious happening right now in the moment. And we've had several of those, through to actually you've got a really good clean bill of health, maybe a couple of ambers that you just need to monitor and keep on top of. You know, carry on doing what you're doing and you know, all that good stuff. But in summary, when people engage in regular health assessments or regular health monitoring, we can see the difference it makes. So we can see that markers improve over time where people do take note of what that first health assessment told them. So, yeah, we do a lot of work around helping people. And cancer, we've got cancer screening cases as well, where we've supported people that have, you know, and there are lots of live case studies within our organisation where individuals have said, that day, coming and having that health assessment saved my life.
Wow. So, yeah, that's something that must make you very proud and
extremely proud.
Yeah, of the service that you offer. Have you seen people kind of change their lifestyle as a result? So they've got some feedback and now they've taken up some kind of health program or...
Yeah, so what we do is we gather information around what our customers tell us they go on to do. And one part of our service that we offer is health coaching. So when we work in partnership with our business customers, so bit of context, what we do at Bluecrest is offer health assessments direct to consumers. So people can go onto our website or call us and book a health assessment directly. But we also work in partnership with lots of organisations and lots of companies that invest in having or offering health assessments to their workforce. So in some of those packages, what we also offer is health coaching. So we know that from that first health assessment that people go on to do things that make a difference. So for example, 39% of our customers go on to lose weight. So there are a number of different things that will be, you know, a positive impact as a result of what we do for our customers. Some go on to change their diet. Some go on to improve their sugar levels because they've got an emerging problem with things like diabetic or diabetes, you can see that could be a problem if we don't change habits. So yeah, and then what those individuals tend to do is come back, have another health assessment and see that their markers have changed. Another really good example is you get given what's called your metabolic age, right? So we know what our birth age is. And one of the tests we do is a biometric analysis. And what that does is look at inside your body and the health inside your body. And you get that metabolic age. And it's made up of a number of different factors. And it's quite often a point of competition within our organisation. So I quite proudly tell people that I'm 51, but my metabolic age is 36. And why is that? Because I take my health really, really seriously. Now, you can't keep making that younger and younger and younger, but that differential is all about looking after your organs, which you can't see, right? You can't see those from the outside. You know, some of the symptoms we experience with health are not always visible, and sometimes you don't even feel them. So we joke a little bit about this internal age, but it really matters because visceral fat is something that's not visible to the eye. And if you've got visceral fat, that can be a predictor of long-term health concerns and health conditions. So they're the kinds of things that we'll be doing for our customers that help them. We had a lady customer who came through one of our corporates, mortified that her metabolic age was 10 years older than her actual age. She took it really seriously and only last week came into clinic, had her health assessment, and she's now 6 years younger than her real true age because she went on to take action about what that initial assessment told her. So it can be really kind of action driving. The assessment can be a really good way of initiating doing something about it if you're worried about it. So yeah, it makes a real difference when people engage.
Amazing. And, you know, one of the things I wonder is, we all know that we should look after our health. We all know it's a good idea to be proactive and go for screening. What do you think it is that puts off so many people from actually doing that?
They're frightened. And it's really interesting. I've just had a weekend away with some girlfriends at a yoga retreat, actually. And two of the ladies that I was away with have been saying to me, I must get a health assessment. And this has probably been a conversation that's been going on for over a year with these two individuals. And this weekend I said to them, so what's stopping you? You keep telling me you want one, but what's stopping you? I'm frightened about what the result's going to tell me.
Yeah.
So it's trying to work through those objections and say to them, you know, well, surely knowing what's wrong gives you something to act upon and do something about. So I think some people are just a little bit fearful. And it's not a frightening process. You know, the health assessors are absolutely wonderful. Yeah. They put you at ease. And of course, once you've got that result, you can have a look at your kind of profile of results and say, right, what do I want to do? What's important to me and what do I want to do about this? Because the fundamental thing that I believe to be true is every single one of us wants to live longer, but healthier for longer. You know, and the reality is we've got an ageing population. People are living longer, but wouldn't it be great if what we did was always deliver that outcome of that individuals are able to live healthier for longer because they've engaged in regular health monitoring. They're taking care of their body and the metrics that they get as a result of that health assessment, and they can do something about the things they can act on. If we could get everybody in society taking ownership for their health, wouldn't that be cool?
Yeah, it would make a huge difference to the health of the nation, wouldn't it? And to the NHS, it would make a huge difference. We know what pressure that is under. So how does what you do at Bluecrest fit in with the NHS? You know, one of the things that you talk about is being affordable. If I were thinking about, you know, where to spend my money and what should I do to invest in my health, what could I get on the NHS? What could I get differently at Bluecrest? How do they kind of complement each other?
So let me start by telling you a little bit about the why Bluecrest was founded. So Bluecrest was founded in 2012, and it was founded to fill a gap in the market. So if we rewind to 2012, there were probably 2 or 3 other providers doing what we do, privately doing what we do. So the very well-known brands of Bupa and Nuffield, who have done great work in this area. But to have a health assessment with either one of those providers back then would have cost you about £800 or £900. So that's out of reach for most people, right? Yeah. That's a lot of money to spend on yourself. And most of us choose not to spend money on ourselves. We tend to spend money on our loved ones rather than ourselves.
Yeah.
Roll forward to 2020 and we move into a pandemic. That pandemic fundamentally changed the way that people thought about health, fundamentally changed it. And post the pandemic, we have seen an explosion of provision in this sector. So there are lots more providers now doing what we do. The fundamental thing that any of us have I think, as kind of the population citizens, that I think we have a responsibility to do is take ownership for that. We should be monitoring our health and we shouldn't be relying on the NHS every time something goes wrong. And the reality is we enter the NHS or we enter the health system when something has gone wrong and we need to treat disease or disorder. So by the time we're there, we're looking at what can we take to fix this problem. But we haven't monitored, is there an emerging one? So what Bluecrest is all about is helping people take control of their health in order that they can take action that might prevent long-term health issues that, if you do something about today, could stop the onset of diabetes, a major issue across our society, for example, just giving one reason for that. When we founded Bluecrest, we founded it on the principle we wanted to make health assessments and health monitoring accessible to all. So that value stays true today. We work really hard on keeping our price point to an accessible price point so that most people could do this if they wanted to. So a health assessment with us starts at £169. Now, all of us by law have to have our cars MOT'd, but by law we don't have to have our health checked. Now, the great thing is, of course, is the NHS have their national screening programme, but the reality is the uptake rate for that is quite low. So how do we shift the narrative? How do we shift society's approach to this such that they take that ownership and we keep people out of GP surgeries? And that's what I think we do. We help people gain a really good insight into what's going on inside their body so they can act on that. And quite often the action they take doesn't require them to visit a GP. And that really matters. I mean, we provide GP services as part of our offer anyway. So anybody that buys a Bluecrest health assessment has access for a full year to a 24/7 GP helpline for episodic care. So we offer that service as part of our £169. Everybody gets that. So what we're trying to do is work with and alongside, and our whole mission, our whole ethos is aligned to the 10-year plan and the prevention agenda. So we very much want to be a part of solving the population health issues and working alongside the NHS such that we are aligned to that vision of helping people live healthier for longer, and that prevention agenda is really important.
Caring for someone you love is one of the most important things you'll ever do, but it's not always easy. At Unique Senior Care, we're here whenever you need support. Whether it's a bit of advice, short-term respite, or ongoing care, we've been supporting families for over 15 years, and you can lean on us too. Call 0808 134 1164 to speak to a care expert or visit uniquecare.co.uk.
One of the things that the NHS focuses a lot on, rightly so, is health inequality and the fact that certain groups in our society don't have the same health outcomes. Certain groups are more likely to experience certain illnesses or not get the same level of health care as others. So what kind of things do you do at Bluecrest that help to maybe identify some of those gaps and to reach those people who might be missing out traditionally?
So it's a really good question, because in some of those some of the areas that you've just talked around in terms of health inequality, or parts of the country that are in deprivation or probably don't even think about engaging in this, that requires education. So one of the things we'd love to do is work alongside the NHS on how do we target some of those areas of need. And I'm working very hard at the moment on pulling together, so what does our data tell us? So we've served just under 1 million customers in our time. So we can see when people have more than one health assessment, what difference that makes. And we're working on how do we present that data in a way that we can get buy-in to work with some of the ICBs on targeting zones where we can drive uptake to the NHS health check where possible. Now, there is a difference between the NHS health check and a Bluecrest health check. The NHS health check is quite a basic health check. It's a good it's a good health check. It does what it needs to do. The Bluecrest health check has more that we test for. So, for example, we do things around heart health. Another big issue, cardiac health in this country is a big concern. So we offer things like plaque test and little lipoprotein A tests, which are not routinely offered by the NHS. In fact, they're not offered at all by the NHS. And they're certainly not part of the NHS health check. So what we hope to do is complement some of the NHS work by offering slightly deeper tests that otherwise people couldn't get if they were to go direct to their GP surgeries.
Okay. So what you were saying about the ICB, so ICB is an integrated care board.
Yeah.
Maybe it's a term that people are not familiar with. Can you explain a little bit about what an ICB does and how you might link with them? Am I right in thinking that what you're saying is potentially people who might not have the £169 to pay for your screening, that you might be able to work with their local ICB to support them?
Yeah, I think we'd love to do more work with the NHS directly. The reality is at the moment we don't. So the services we provide are privately paid for by the customers that come to us or the companies that fund that for their employees. So that's fundamentally how we operate today. We see an opportunity to partner with the NHS and be part of solving some of those population health issues. So what ICBs will be doing is looking at their local communities and looking at where they've got issues that might be addressed or could be addressed by understanding more through health checks. So we see an opportunity to partner with and work alongside, but it's quite hard to do. The reality is at the moment, the NHS is going through immense change and there'll be a move to what will be centralised, so what will be driven centrally by government and what will be devolved to local community management. So whilst that's going on, what we champion is take ownership of your health. If you can afford that £169, it will be worth it in the long run if you get ahead of a cancer or you get ahead of something else that could be a long-term health issue for you, but could also cost our NHS money downstream. Spotting the signs of things like cancer really, really early means that you could avoid unnecessary treatment. So, for that kind of money, which, by the way, if you subscribe to our service, you can break that cost down and pay monthly, which makes it much more affordable. So, in the big scheme of things, it's not a lot of money for you to take responsibility. But back to the point about the integrated care boards, their job is to look at their population needs and understand how they shape their services to meet those needs, whether that be healthcare, whether that be social care, or whatever that might be.
Yeah, so they try and link everything together, don't they? They were came into being because people were falling in between the gaps between health and social care and different kind of organisations and pots of money. And as the name suggests, they wanted to integrate all that together.
That's right.
So you mentioned one of the reasons that we often don't be proactive and health screen and find out is fear. One of the others that comes to mind, particularly for some sorts of screening, would be embarrassment. So it's been in the news that as of next year, the NHS may be offering cervical screening kits that can be done at home because only about 7 out of 10 women are actually taking up those services. And a lot of that does seem to be about the fear and embarrassment of coming in to see your nurse and to have, an invasive procedure and as sensitively as it's done. We have a wonderful nurse at my local practice. She's absolutely fantastic. She gets you to do deep breathing and she chats away to you. She makes you feel so comfortable. But it is a challenging process to go through. And some people, because of their background, trauma, what's happened to them in the past or other factors, might find that incredibly difficult. So what are your thoughts on home testing and what the NHS is doing there?
So back to the point about embarrassment. So if any of you come for a health assessment with Bluecrest, you do not need to remove any clothing. So that's a really good point, actually, because I think most of us worry about taking our clothes off in front of other people. So you'll need to take your shoes and socks off to do your biometrics. You'll need to roll your sleeve up to have your bloods taken. You'll need to have clothing that you can pull up your legs to have your ECG leads put on and your pad test leads put on. But you won't need to take any clothing off to come for a health assessment. So that's a really important point, actually, because I think that is sometimes the small things are what people sweat. And I think the issue with HPV is a really important one. Cervical cancer is one of the most difficult cancers to treat. So staying on top of your cervical health is really, really important. And I think the other thing that gets in the way is it's not just embarrassment, it's time. It's the time it takes to book an appointment, to get through to your GP surgery, to make an appointment at a time that's convenient to you. And often that's not the case. You have to take what's available to you. Driving to a surgery where you can't get parked, getting in, waiting, and sometimes that can be a while. So I think there are other barriers alongside that embarrassment point. But I think you're right, the embarrassment point might be the one that trumps a lot of our... although I think our younger generation are better at this, actually, in some respects. But yes, if you come for a Bluecrest health assessment or you can take home a HPV home test kit and do it in the comfort of your own home. It's really easy to do, very, very straightforward. We've got some nice videos online that talk through how to do a HPV test. And of course, then you haven't got to go anywhere. You're in the comfort of your own home. You send the test back, you pop it in the post box, and you're monitoring your health, and you're ahead of anything that might prevail. So I think there's a real merit in the approach that's being taken to getting this rolled out nationally, and I think it's really important we do so.
Yeah, and great to know that you're already doing that.
Yeah.
So if somebody doesn't want to wait until next January 2026, which is when the rollout for the home smear tests is going to happen on the NHS, actually they could think, right, well, I don't feel comfortable going into my GP surgery, but I would come to Bluecrest and get the opportunity to do that home test.
Yeah, exactly. So, please do if that's something that you're worried about. It's not expensive.
The Unique Senior Care Advice Hub is a free online resource to help you make sense of care. It's full of expert advice, practical guides on things like dementia and funding, and real stories from families who've been in your shoes. Visit uniquecare.co.uk/care advice hub to feel more confident about what comes next.
You mentioned earlier about we're more likely to look after other people and spend our money on other people than ourselves. Sometimes we don't feel like our health is worth investing in, or that, we don't feel that self-care and looking after ourselves is important. We maybe even see it as selfish. What would you say to someone who's coming from that kind of mindset?
I would say to you, have a look at some of the case studies that we have that are quite across our social media channels or our website for those people that we've picked up cancers for. So, for example, let's talk about bowel cancer. If you pick that up early enough, the intervention or the treatment required is quick and it's easy to do. And it's probably minuscule amount of time that you'll need to take out of work. If you don't pick it up early enough, you could be living with a life-changing stoma bag because you got there too late. Yeah. And at that point, you'll have probably had to take several months off work. You'll have had to have several rounds of treatment. You'll be worrying about whether you can pay your mortgage because you have exhausted any sick pay that you might have had. You'll be going through an expensive treatment service with the NHS to go through and manage whatever that means for you. The long-term effects of things like chemotherapy are really ill understood. I saw that with my own dad who went through bowel cancer, and what you live with post-cancer. I think sometimes people forget about that. So I would say to you, if you weigh up the cost of £169 versus preventing the ongoing growth of whatever's going on in your bowel, it's worth every single penny.
Yeah, great example and a reminder that actually, these things are looking after ourselves. That's selfish. I can't look after myself. Actually, if you do it, you're being more able to support other people and care for other people. It's something we say to our carers a lot. Actually, looking after yourself is important if you want to sustain supporting others and being the best that you can for them. Your self-care and doing those things that make a difference to your well-being are actually really important.
they help you be your best you, right?
Yeah.
So when you feel good and you feel well and you feel healthy, you not only do your best work if you're working and you love what you do, you give your best to your family and your friends and the people around you, and you get to do the things you enjoy. So why wouldn't you want to have that insight to enable you to continue to do that? And then if you do get a red or an amber on your health assessment, you actually get given really clear guidance around, so what now you need to do, or to improve this health marker, this is the action you might want to consider taking. And often it's really simple things, so for example, we've been looking at the profile of our results, and we all look at all of our data in an anonymised way, but we can see across the different age cohorts what happens on a first health assessment and whether a health marker improves on that second health assessment. We can see what happens from a seasonal perspective. So when you look at things like vitamin D levels, totally aligned to summer and winter. Now, if you know your vitamin D dips over the winter period, you can take a vitamin to support that. And vitamin D can make, if you don't have enough of it, can make you feel quite lethargic. So, and you can have fatigue, and you might think that's something else. So there are some really simple things that a health assessment will give you insight into that you can take action on and do something about. I personally think we should make it mandatory that everybody, I would say that, wouldn't I, because I'm the chief exec of a health, but genuinely, seriously, I was engaging in health assessments before I took this role, and I didn't come looking for this role. I was approached for it, and now, knowing what I know, I feel so passionately about this. I want to. I'm an old mum, as I keep telling everybody. I had my son at 42. I want to be able to be active with him when he's in his 20s. And how, what's my lever for doing that? Understanding what's going on inside my body, acting on what it tells me, and do my best to stay healthy and well. And that's not to say, deprive yourself of all the things you love, but it enables you to, I think, live life to your best and do the things that make a difference to you, giving that quality of life. And I think, who wouldn't want that?
Absolutely. So I don't have to give up cake if I come and see you.
You absolutely don't have to give up cake. It's everything in moderation, right? It's everything in moderation.
That's good news. So you take your health very seriously. That's very obvious. You've got this fantastically younger than you are metabolic age. What specific changes have you made in your lifestyle, if you don't mind sharing the personal steps that maybe you've taken since starting health screening?
So the metabolic thing is quite important because or should I say the way in which I eat probably is something that, so I don't deprive myself. I enjoy the things that I enjoy doing. I like to have a glass of wine when I want to have a glass of wine. But I now know that there are some really simple things I can do around how I eat on a daily basis. So making sure I get the right level of protein in my food, making sure when I eat my meal that I take the first bite of what I take is a protein first, because that's really good for inside my body. I make sure that I understand my omega-3 levels, because that's really important for bone health and for things like eye health. So I take an omega-3 supplement, which was a result of me taking my health assessment, and that makes a really big difference. I try not to snack too much. So when I have a meal, I have a really good, well-proportioned meal, but tend not to snack in the middle. And I drink lots of water. So at least my 2 litres a day. They're really simple things. It doesn't stop me going out for dinner. It doesn't stop me having a piece of cake if I want a piece of cake at the weekend. And it certainly doesn't stop me having a glass of wine with my friends when I go out for a meal with them. But that kind of eat well, and lots of good leafy green veg, really, really good for you. And especially for men, things like greens, broccoli, green beans are really good for prostate health. So they're the kinds of things that that I've learnt as a result of the job I do. And they keep me fit and healthy and keep me active, and that's what matters.
And I guess if you're working with a health coach, it's very individualised. They'll look at your specific results, and they will tailor something that's for you and your needs.
Yeah, and I think what's really important about this is I don't think we'll ever shift the societal view of health monitoring unless we see real, true behavioural change. And that's the shift we need to make, is that we all take individual ownership for our health and our health data. It's not our doctor's job to do that. That's our own unique responsibility. And when you have the power of data in your hand to see what your health is telling you, you then know what action you can take to take control of that. And it enables you to engage in a really constructive conversation with a GP. So with our health assessments, if you include the one with a GP consult within your health assessment package, you will talk to one of our GPs, and that GP will talk to you about what your results so you'll have your profile of results. What does that tell you you might need to think about doing, or what action you might need to take without any medical intervention, or is there something here that means you might need to step into some kind of onward pathway that you need to take action on? So the beauty of that, but that's data in your hand that you can then act on and do something about. And I think that's what's really important. But that shift, we're a way off from that, because our health system is set up to treat disorder and disease and medicate for it, not prevent for it. And we've got to move to that prevention agenda if we're to take the pressure off of the system.
And we see that the NHS are trying and moving in that direction. But it's interesting to hear that post-COVID, a lot of other companies have started to grow in this area. We know there were a lot of really tragic consequences of COVID and the after effects on people's mental health and well-being. But actually, it's encouraging to hear that maybe it's also been a driver of something else, of thinking about our health and what we can do.
I think COVID did a couple of things, actually. I think it parachuted health onto our consciousness in a way that I don't think anything else ever would have done. And I think it also raised the profile of social care and the very important role that both carers, but also our nursing and doctor staff take, and the importance of our system, and why it being a functioning, really well-run system is so very important. Yeah. So I think all of us have taken our health more seriously. So I think it's that shift in mindset that has driven the change in people's behaviour to want to do something about it. And with that has come this emergence of different providers out there, and they all do slightly different things. Some just do home test kits. Some, like us, do a hybrid offer. Most of what we do is in clinic, because we tend to find, we know the fact is a venous draw blood test is more accurate than a home test kit, and you can test more off that. But yeah, without a doubt, I think it's the whole shift to health being more front of mind has been the outcome of COVID, and that I think is a good outcome. I think that's a good thing, that we all take our health a little bit more seriously.
Thank you so much for talking to us about health screening. It's really fascinating to hear the impact that it's made on people, your personal journey as well, and how accessible it is. If you could give our listeners one piece of advice in wrapping up our conversation today, what would that be?
That's a really good question. So first and foremost, we launched our health intelligence questionnaire a couple of months ago, or what we're calling our Health IQ. So I would encourage anyone listening today to go onto our website, www.bluecrestwellness.com, take the survey. It's 11 questions, and test your health IQ, because what we learned from that exercise was we have got a problem kind of nationwide around people's understanding of health and what's important. And this is quite basic stuff. So go and take the health IQ, because that from there, you can decide what you want to do about acting on your own thing, and take ownership. Take your data into your hands, take your health into your hands and own it, because genuinely by doing that, you will enable you'll put yourself on the path to living healthier for longer, and who wouldn't want that?
Thank you so much, Dom, for talking to us today. Some really valuable insights there on what we can do to look after our health. So I'm certainly going to go and do that survey, that questionnaire myself, and see what comes from it. And thank you to everyone for listening. We do hope that you found this episode useful. And if it's prompted you to think about getting a health check for yourself or a loved one, then you can look into the options available. You'll find a special discount code to your Bluecrest health check in the links below this podcast, as well as links to everything else that we've discussed. I've been your host, Jo Cleary. You're listening to the Care Podcast, brought to you by Unique Senior Care. We hope that you'll join us for the next episode.